I believe that you need the know-how on how to heal your child's wounds properly. Do you have an active and curious child? I know it is almost impossible to avoid cuts and scrapes in an active child, which is why you need the right information on how to deal with his or her wounds properly. In this video, we are going to talk about cuts, scrapes, and scars in kids. Hi, I am Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Cuts, scrapes, and scars in children. How to treat a small cut or a scrape? Well, for almost all kinds of active bleeding, you apply direct pressure over the wound using a gauze or a clean cloth for 5 to 10 minutes. The most common mistake is interrupting the pressure to peek at the wound. And once the bleeding has stopped, you can clean the wound with soap and water for 5 minutes. This decreases the chance of any infection. But if your child objects to it, you can soak the wound in the bathtub. After cleaning, you can apply a small amount of antibacterial ointment to keep the wound moist, and you can cover it with a gauze. Does your child need stitches? Well, the general guideline is that if your child has a cut that is deep and goes all the way through the skin, your child probably might need stitches. If your child has a cut that is gaping with a visible dark red muscle or yellowish fat, probably might need stitching. If your child's wound or cut is gaping with at least half an inch long, probably would need stitching. If your child has a cut that is gaping, even if it might be small, it is best to have them checked out. If your child has a deep cut that is gaping or in a cosmetically sensitive area, it is best to ask your pediatrician if your child might need stitches. Options for closing a small cut. Well, one option is the use of a skin glue, where the glue is applied over the cut as it is being held close. It is useful for straight cuts that are small, and the use of skin glue is not as strong as stitches though, and is not useful for areas where there is tension. Another option is the use of steri strips or the butterfly bandage adhesives, which are narrow adhesive strips which are placed on cuts. They are useful for small cuts that are not as deep. They can stay in place for 3 days, although they are not as strong as stitches. Another option are stitches, which provide more strength and has little risk of being pulled off too soon, although putting on the stitches can be traumatic for the child. There are absorbable and non-absorbable sutures. For absorbable sutures, they do not need to be removed, while non-absorbable sutures need to be removed about 5 to 12 days later, depending on the location. Another option are staples, which are used for cuts in the scalp. They are fast to use and can close the cut almost as well as stitches. When to go see a doctor? Well, for most cuts, it is generally okay to wait for at least 24 hours after the injury. Although there are some cuts that need to be closed sooner, it is safe to wait for at least 8 hours. When you decide to wait, you should wash the cut under the faucet to let out any dirt. And you should keep the cut moist by putting wet gauze over it and tape it. Now, how to make the scar less visible? Once your child's wound has completely healed, there are some things that you can do to make the scar less visible. One thing is to offer sun protection. You can apply broad sunscreen and use a hat or clothing to minimize sun exposure. You can also do massaging of the scar to help soften and flatten the scar. Or you can also use silicone gels that will also help soften and flatten the scar and make it less visible when used up to 12 hours a day. Is the scar getting bigger? Well, sometimes, no matter what you do, the scar may not look as good as you would want to. Most of the time, it is a cosmetic issue. It might be a hypertrophic scar or a keloid. A hypertrophic scar is a permanent scar that forms as the wound heals. It might be pink, red, or purple. While a keloid are scars that have spontaneously enlarged and are usually above or extend beyond the injury. Once you suspect that your child has a hypertrophic scar or a keloid, talk to your pediatrician if your child might need to be referred to a plastic surgeon and might need treatment. Hey, if you like this video, watch my other videos where I teach you about other child health problems.